So, if you've ever had that nagging back pain that just refuses to leave you alone, this is for you. We're about to dive deep into a really important study that asks a simple question. When it comes to back pain, is it better to just put out the fires as they pop up, or should you be focused on prevention all along? Let's find out. You know the feeling, right? If you've ever dealt with low back pain, you know that frustrating rhythm. It gets better. You feel amazing, you're back to living your life, and then, out of nowhere, it's back. It's this exhausting loop, and trust me, you are not the only one stuck in it. And this isn't just something you're imagining. It's a real, well-documented thing. It's often called recurrent or persistent low back pain. So what does this pain loop actually feel like day to day? Well, it's a story you probably know by heart. The pain flares up, so you go see your chiropractor or another provider. For a while, you feel relief, things are good, and then, inevitably, the cycle starts all over again. It's a really frustrating pattern, and it's exactly what researchers wanted to get to the bottom of. So the big question is, how do we get out of this loop? Is there a better, smarter way to manage this for the long haul? Well, as it turns out, there are two pretty different schools of thought on how to do just that. When you look at chiropractic care for this kind of issue, it really boils down to two main strategies. You can basically think of it as treat the problem when it happens versus try to prevent the problem from ever happening. Okay, this is where things get really interesting. On one side, you've got what's called symptom-guided care. Pretty simple. You only go in for treatment when your back starts acting up. On the other side, you have maintenance care. This is proactive, scheduled visits, even when you're feeling perfectly fine. The dental analogy here is just perfect. Symptom-guided is like only going to the dentist when you have a horrible toothache. Maintenance care? That's like getting your regular cleanings to stop that toothache before it even starts. So here it is, the million-dollar question. Which one of these approaches actually gives you a better quality of life over the long run? That's precisely what a big team of researchers in Scandinavia wanted to figure out once and for all. And that brings us right to the main event of our explainer, the Nordic Maintenance Care Program study. I mean, this was a massive project designed to get a clear scientific answer to that very question. Now, let's be clear. This wasn't some casual online survey. This was what's called a pragmatic, randomized, controlled trial, which is pretty much the gold standard in medical research. It means the study was designed to be super rigorous, totally unbiased, and to reflect what actually happens with real patients in the real world. So how'd they do it? First, they found 328 people who were already getting good results from chiropractic care for their low back pain. And that's a really crucial detail. They started with people who were already a good match for this type of care. Then, they randomly split them into our two groups, the maintenance group and the symptom-guided group. And get this, for a full year, they tracked everyone, every single week, with a simple text message asking, how many days this week was your low back pain bothersome? All right, so after 52 weeks of collecting all that data, the researchers finally had their answer. It was time to crunch the numbers and see what the verdict was. And the result was pretty clear. The group that was getting proactive maintenance care reported, on average, almost 13 fewer days of bothersome pain over that year. That's not a small difference. That is a huge deal. Seriously, just let that sink in for a second. 13 fewer pain days is almost 2 extra weeks of your life back. 2 more weeks where you could work without wincing, play with your kids, or just go about your day without that constant nagging pain. That is a game changer. Okay, so a better outcome sounds amazing, right? But in the real world, and especially in healthcare, there's almost always a trade-off. So what did it cost, in a sense, to get those 2 extra weeks of feeling good? And here's the other side of that coin. To get that big drop in pain days, the maintenance care group needed, on average, about 1.7 more treatments over the course of the year. So let's just round it up and call it 2 extra visits. And this chart right here tells the whole story. It's the core of the entire study. On one side, you have the benefit. The maintenance care group had significantly fewer pain days. On the other side, you have the cost. That same group had just a slightly higher number of treatments. Fewer bad days for a couple more visits. That's the trade-off, plain and simple. So after all of that, what did the scientists who ran the study actually conclude? And, more importantly, what does all of this mean for you? Here it is, the official conclusion right from the study itself. They said that for selected patients, and remember, that means people who already knew chiropractic care worked for them, maintenance care should be considered an option for tertiary prevention.
Now, tertiary prevention is just a fancy science term for preventing a long-term problem from getting worse and impacting your life. They're not saying it's the only way, but they are saying it's a totally valid, evidence-backed strategy.
So let's wrap this all up. Here's the bottom line. Proactive, preventative care resulted in almost 2 fewer weeks of bothersome pain over a year. The catch? It cost about 2 extra visits to the chiropractor. And the big condition is that this really applies to patients who fit that specific profile, people who've already had success with initial chiropractic treatment. So the takeaway is that maintenance care is a scientifically supported option that's absolutely worth discussing with your provider. And that really brings us to the final question, and it's the one that only you can answer. When you look at the evidence, is that trade-off worth it to you? Is the time and the cost of 2 extra appointments worth gaining back nearly 2 weeks a year without that nagging pain? The science can't answer that for you, but it definitely says it's a choice worth considering.